Thanks very much for coming. I'd like to start by thanking all of our coalition partners who took time out of their busy days today to be here as part of the We Care for California Coalition as we kick off a year of advocacy to not only restore the cuts that have been made to Medi-Cal reimbursement rates back in 2011, but to bring those rates up to Medicare levels. Another big thank you to the authors of the legislation we're talking about today, Senator Hernandez and Assemblymember Bonta. As chairs of their respective legislative committees, the health committees, they know that the importance of ensuring health care coverage is more than just an empty promise, but patients need access to real care through a system that can be created to do so. As a rural general surgeon, I practice in Eureka, Humboldt County, about 5 hours north of here. I see all kinds of patients coming through my office, the emergency departments, and in the operating rooms. Quite a few of those patients have been faced with a delay in receiving care because of the difficulty in finding physician offices that are still able to accept new Medi-Cal patients. Many of them come straight through the ER because they can't do anything else. As you'll hear today, California's Medicaid levels are some of the lowest in the nation. With over 12 million people enrolled in the program nowadays, it's hard for physicians to take on new patients and to keep their doors open. My wife, with whom I practice, also a general surgeon, we moved to Humboldt County to be part of a community where we can make a difference. We left faculty positions at Stanford to do that. We provide care to those who would otherwise be forced to travel hundreds of miles to receive care for routine surgical procedures. Unfortunately, though, with Medi-Cal rates as low as they are, it becomes nearly impossible for specialists like us or for primary care physicians to increase the number of patients that they see in this program. Today's hearing and the efforts led by these legislative leaders and the group of people standing alongside us will shed light on some of the problems that patients and providers all across California are facing in Medi-Cal. I'd now like to introduce Senator Hernandez.
Good morning, and thank you for the introduction. Let me first start off by thanking the media for being here this morning to talk about an issue that's very, very important to me. I want to share with you a couple statistics. The average men's haircut in the United States is $28. A dog grooming treatment at PetSmart will run around $27. And a large pepperoni pizza at Round Table is $24. So you're asking, why am I saying these particular numbers? Well, do you know that yet a physician who has a traditional Medi-Cal visit, it's around $16. And this is the amount a physician gets paid for a regular primary care visit under the Medi-Cal program. And California ranks 47th amongst all the states with reimbursement rates. So for me, if you look at what has happened here in the state of California and the leadership role that we have played in the implementation of the Affordable Care Act, we are just light years ahead of the rest of the country. And the success of the Affordable Care Act in this country is going to be dependent on what's going to happen here in California. But yet, we have these horrible rates that we pay providers. And something needs to get done and needs to be fixed. Now, this is more than just provider rates. To me, it's all about access and providing care to the absolute most vulnerable population in the state of California. And by having such poor rates, there's less providers that will take Medi-Cal, there's less providers that are going to get in managed care and in the fee-for-service of Medi-Cal, and therefore you're going to have less providers that are going to be available to that population. And let's talk about and let's think about that population right now. We've heard all of the numbers that are going on right now with regard to Cover California, and I'm just really excited and proud of the fact that they're doing a great job. But there's a number that's just dwarfing those numbers, and that's the Medicaid population. Right now, it's up to 1/3 of the population that are covered by Medi-Cal. But I can guarantee the provider networks out in the commercial market, out in the market where you work, but in particular in Cover California, doesn't even come close to the provider network that we have in Medi-Cal. And to me, that's embarrassing. And the only way we're going to address this is by increasing those rates to allow providers to take Medi-Cal. But the other problem we have is the few providers that take it don't take enough of them, they won't take new patients, and possibly they're only going to take a few of the older patients that are already existing. And when they take them, there's a lot of cost shifting in the system. And all that cost shifting is going to go to either to the ER, it's either going to go to Cover California. So what we need to do to stabilize our healthcare system is we have to make sure that we have equity payment within all of the systems. But let me just close with this. And why is it that I feel so strong that we have to make sure that this has to be about access to care for the most neediest? There's two areas. The good doctor was talking about where he chose to practice, and I commend him for doing that. But the two areas that have the greatest need, especially in Medi-Cal, are the rural communities and the inner cities and the communities of color. And it is those communities that have the absolute highest incidences of chronic disease, diabetes, or high blood pressure. And I am convinced, even in California, the greatest state in the nation, we have a two-tiered healthcare system. We have a system for those who are wealthy and have money, and we have a system for those that are poor that don't have the same access, and something has to be done with it, and that's why I'm standing here with Assemblymember Bonta to introduce this bill, because I think this is a social justice issue. So with that, it gives me great pleasure to introduce my counterpart in the Assembly, and that's the chair of the Assembly Health Committee, and that's Assemblymember Rob Bonta. Thank you very much for allowing me to spend some time with you this morning.
Thank you, Dr. Hernandez, for that kind introduction. I'm very excited to be here. I'm Rob Bonta, serving the California State Assembly, represent the 18th Assembly District, the great cities of Oakland, Alameda, and San Leandro. I want to thank the We Care Coalition for their support and their leadership in putting together today's press conference. And also, I just want to thank Dr. Hernandez again for all his tremendous leadership. I'm very proud to be a partner with you in this important work. And I also want to recognize my colleague and friend, Dr. Jim Wood, who's up here standing in support as part of this impressive coalition. I was very honored this past December to be appointed chair of the Assembly Health Committee by Speaker Tony Atkins. I served on the Health Committee for 2 years, and it was during that 2 years that we were in the midst of a very dynamic and transformative time in California healthcare policy with the implementation of the Affordable Care Act. And with the implementation of the ACA, our state can truly say that we are making a difference for all Californians. We enacted a policy that enhances the everyday lives and outcomes for those most in need. And with the ACA's significant expansion to provide health care to more of our most vulnerable Californians, and the increased awareness of many of the importance of health coverage, Medi-Cal enrollment has skyrocketed. We've seen the data. It's now almost about 12 million people on Medi-Cal, nearly 1 in 3 Californians. And this expansion, however, has exacerbated and drawn more attention to what has been an ongoing problem. Many years of reduced reimbursement rates and underfunding have resulted in a severe shortage of doctors to serve the needs of this growing population. California's Medi-Cal reimbursement rates, as we know, are among the lowest in the nation. And there's a statement in politics that as California goes, so goes the rest of the nation. And I'm proud that that's true in many areas of policy. I'm very disappointed that that's not true in this area, and in fact the opposite is true. So we need to change that and be the leaders that we have been for this country for so long. A recent report by the California Healthcare Foundation found that California's primary care rates were ranked 48th amongst state Medicaid programs. For all Medi-Cal services, California's rates ranked 47th amongst all state Medicaid programs. Only 57% of physicians in California accept new Medicaid patients, the second lowest rate in the nation. This severe underfunding significantly diminishes the state's capacity to ensure high-quality health care without timely access to a primary care physician. Care, as we all know, too often takes place in the emergency department. Increasing Medi-Cal rates also reduces the significant cost shift that occurs as private insurance must pay more to cover the cost of the underfunding of the Medi-Cal program. Although we are all thankful that the Affordable Care Act expands Medi-Cal eligibility, coverage without real access means that millions of Californians are walking around with insurance cards that carry no or little weight. Senator Hernandez and I want to ensure that obtaining an insurance card is not an empty promise and means real access to authentic quality health care. That's why we've introduced AB 366 and SB 243 to bolster provider participation in the Medi-Cal program, resulting in the reduction of unnecessary costs to the state while ensuring access to high-quality health care for Californians' children and adults. That insurance card should ensure access, and we are committed to the proposition that everyone who has taken the time to enroll will be rewarded with real access to health care. As some of you may know, when I was a young boy, my family immigrated from the Philippines. We came to America seeking new opportunities and a better life. My parents were farm worker organizers with the United Farm Workers of America, and we lived in a special place called La Paz, which was the headquarters for the UFW movement, which I believe was one of the greatest social justice movements in the history of our country. And as I was growing up, my father set up healthcare clinics for farm workers and later for other vulnerable communities throughout the state. And I witnessed firsthand growing up the importance of protecting and providing critical services to the most vulnerable members of our community. I believe that everyone has a right to healthcare coverage. I believe that healthcare is not a privilege for the few, but it is a right for all. And just as the Affordable Care Act was a remarkable first step towards providing everyone in the United States health care coverage, AB 366 and SB 243 are critical steps toward ensuring that coverage is meaningful and actually ensures true access to quality health care. Thank you all for being here today. I look forward to the work ahead that we will do together. And I would next like to introduce a patient, Sylvia Dominguez, patient navigator for Sacramento Covered. Thank you.
So good morning. My name is Sylvia Dominguez, and I'm a patient navigator for Sacramento Covered. I do work at Methodist Hospital in the ER department. So my job there is to find patients that come to the ER for primary care services, a primary care doctor, but to also make them a follow-up appointment with this doctor so that they can get established. That is much easier said than done. Medi-Cal patients are facing two major barriers in obtaining primary care services outside of the ER, and they are the following. Doctors' offices don't have appointments for weeks or months at a time. This reminds me of a particular patient that I served a few months ago. This patient was believed to have a highly aggressive form of cancer and was unable to get to see his doctor for several months. He actually ended up in the ER because of this, and I was able to assist him in getting a sooner appointment. The follow-up appointment I made him with his doctor was made a week from his ER visit, and he still had to wait several weeks after that to even see the specialist. When I followed up with him after his specialty appointment, he explained since the treatment for his cancer had been so delayed, the doctors were not very optimistic about the outcome of his upcoming surgery. After the patient's surgery, I tried to reach him several times, but I never heard back. The other major issue Medi-Cal patients are facing is there are very limited amount of providers accepting new patients, and I face this all the time. I would like to bring up the fact that the doctor list that Medi-Cal provides new patients with, in my opinion, is about 80% outdated, and patients are receiving this list on a daily basis. A very recent example of this is a patient that was supposed to speak today but was unable to attend. This patient shared with me that he had multiple health conditions and had really been struggling to find a doctor. He shared that he used the Medi-Cal doctor list booklet that he received and actually called over 15 different doctor's offices and was told that they weren't accepting new patients. So then he decided to come to the ER for services, and that's when I was able to assist him in finding a provider. I would like to share that hundreds, if not thousands, of Medi-Cal patients end up in the ER every year because of these reasons. And lastly, I would like to leave you with a comment that a doctor's office shared with me one day in explaining to me why they didn't accept Medi-Cal patients. They shared that they had framed the check that they received for $1 from Medi-Cal for rendering services to a patient. And it would serve them as a reminder as to why they didn't accept Medi-Cal patients. Thank you for your time.
I'm Michelle Ross, and I'm a patient registration clerk for Dignity Health Methodist Hospital of Sacramento. I've worked there for almost 7 years, and my job is to admit the patients into the emergency room and other parts of the hospital. With all the recent people enrolled in Medi-Cal, good catch. I would have expected fewer people coming into the emergency room for primary care services. I thought they would be going to their doctor's office for that type of care. But that is not the case. In fact, it's busier than ever. An emergency room is a place for trauma patients, but lately we're overwhelmed with people sitting in the emergency room for hours, waiting because they have a cold or a flu and need primary care services. Over the last 6 months, I've admitted all kinds of Medi-Cal patients who came in with non-emergencies because they can't get in to see their regular doctor or they don't even have one. On one recent Sunday, we admitted about 80 patients who came in with a basic medical need. I recall one patient that came in who was new to Medi-Cal who brought in her 7-year-old son who had an infection on his pinky finger. Though painful, it was not an emergency by any stretch. But she didn't even have a primary care doctor assigned to her yet. It's great how so many people have health care coverage now through Medi-Cal, but really, what good is that coverage if there isn't any access to care? That's why we need to reform Medi-Cal. We need to make it work for the doctors, the hospitals, and other healthcare providers that care for these patients. And we need to ensure that it works for the patients and their families. I personally look forward to the day when an emergency room is just that, a place where people come when they have a real emergency, not a place that they're forced to come for basic healthcare needs. That day will come when Medi-Cal is fully funded, and this bill is an important step in that direction. Thank you. I'd like to introduce the next speaker, Sharon Spurgeon, who is the CEO of Kalinga Regional Medical Center.
Thank you, Michelle. Medi-Cal cuts to hospital-based skilled nursing care put the health and safety of some California's most medically complex patients, frail seniors, and disabled at risk. Medi-Cal beneficiaries make up nearly 80% of the patients receiving this care. These are patients required specialized and medically complex care that freestanding nursing facilities and other healthcare providers simply cannot deliver. The 2011 cuts were harmful to patients and crippling to hospitals, already forced to pinch pennies. Let me give you some perspective relative to our small hospital in Kalinga. Because the 2011 cuts were delayed, the state is now seeking to claw back the difference between 2011 and 2013. For us, it's $5.1 million, or $8,192 a week for the next 11 years, regardless of whether or not we continue to operate. We've already cut to the bone, and these cuts go far deeper. Patients and residents in hospital-based skilled nursing facilities have shorter lengths of stay and achieve better outcomes. Acute hospital readmissions are lower for hospital-based skilled nursing facilities. Without hospital-based skilled nursing care, financial costs and healthcare challenges will multiply. Patients will remain in the acute care hospital longer, adding greater costs to the healthcare system than may be saved through the cuts. Without these resources, many small hospitals and emergency rooms in rural areas across California can't stay open. Residents would need to travel long distances and in very challenging conditions to access medical care. Governor Brown has demonstrated an extraordinary leadership to help address California's budget challenges, and hospital leaders look forward to working constructively with him to address these significant challenges. Thank you very much.
thank you very much for coming. There will be a hearing at 9:30.
Yes.
And we'll continue the discussion at that point. Any questions? Yes, sir.
How much is this going to cost?
Yeah.
We're going to have the LAO look at that, and obviously it'll be determined by the time we get to the Appropriations Committee. When it goes to appropriations, the policy hearing will probably be first, and that will deal with just the policy issue.
And you think the state can afford this, however much it is?
I don't think the state can afford not to do this. That's the question that I need to give to you.
The point to be made there, frankly, is that delayed care is often much more expensive than preventive care. And I see that all the time. I have people coming in with advanced cancers that require very expensive treatment when they could have had a simple procedure that would have obviated the problem in the first place. Colon cancer is an excellent example. Anyone else? Thank you very much for being here. It really matters. Appreciate it.